Some things to think about is are they missing common visual milestones, right? Are they not interested in pictures or objects? Are they not being able to kind of look between items or name colors? Or do they not blink at a bright light? We also have online education for professionals and families. And we're also creating a new CVI Perkins protocol. Perkins School for the Blind is the oldest school for the blind in the country. It's always been on the precipice of, issues that really impact our community. We also need a very specific diagnostic code to really get the advancements we need and to get more doctors who want to learn about CVI and to diagnose. We're looking at CVI. There's researchers who are looking at CVI and autism and CVI and its impact on reading.
Welcome, AGS allies and caregivers. You are listening to the Rare Advocates podcast, brought to you by Aicardi Goutieres Syndrome Advocacy Association, and a special thanks to our sponsor, Biogen. I'm Betty, your host, and a mom of two boys, one of them who has Aicardi Goutieres syndrome. Join us for insightful conversations and updates here on the podcast, where we talk about Aicardi Goutieres syndrome, rare diseases, and disabilities. Now, don't miss out on the conversation, so please subscribe to wherever you're listening to us from, leave us a review, and share with others. We're here to support you on every step of your journey. Hi, Rachel. Welcome to the Rare Advocates. I am so happy to have you here. So, how are you doing today?
I am great, Betty. It's wonderful to be here. Good to see you.
Yes, it's so good to see you and sit down and just have a conversation where everyone's going to be learning so much, because I have in the last 2 times we met. So, Rachel, please tell me a little bit about you and what you do for Perkins School for the Blind.
Sure. So hi, everybody. I'm Rachel Bennett. I'm the director of CVI Now here at the CVI Center at Perkins School for the Blind. CVI Now is a big, comprehensive go-to website. We also have a big parent community that we manage, providing resources and support and services. And our big goals are to, spread CVI awareness, to really help empower families and professionals to advocate and serve kids with CVI, and, build collaboration and coalitions.
And so let's start from the very, very beginning. What does CVI stand for, and how does it manifest different among the population?
Yeah. So CVI stands for Cerebral / Cortical Visual Impairment. It's a brain-based visual impairment. Really, we see with our brains. Our eyes just take in information, and it's our brains that process every single piece of the things that we see and experience throughout our day. Vision is a very unconscious sense, so we don't really quite notice it. But with CVI, since it's brain-based, it makes using vision really hard. It makes it really hard work. And there's a lot of ways that CVI can manifest. People with CVI have a hard time recognizing objects or people's faces. It might have a hard time establishing visual attention, being able to look at something. They might have issues with visual fields. Maybe they only can see something in their right side or on their upper field. It could be people with CVI can have a hard time interacting with people, not being able to make eye contact because they can't recognize faces, not being able to find somebody in a crowd. When it comes to CVI, vision is just really hard work, and it's really hard for the brain to find something amongst visual clutter. And visual clutter can really be an everyday visual scene. And so many people with CVI can only see one thing at a time. So even just with that list, you can imagine how much CVI puts up barriers to access to the visual world, to all the visual learning, to all the visual tasks that happen at school. Even mealtime can be hard, using the visual motor skills. Even getting up and down the stairs can be hard. That visually guided reach of the foot and the leg, the visually guided reach of the arm and the hand. And also a big piece of CVI is that when the brain is tired, when the body is tired, when you're sick, maybe a child just had a seizure, it's really hard to use vision then. Visual fatigue is very real, and vision will just shut down. And many of our people with CVI use these compensatory skills, non-visual skills, touch, auditory skills. A lot of folks use memory and prediction and color coding. My son has CVI, and even though it's the leading cause of childhood blindness and low vision, the medical community and the educational community still have a long way to go to recognize it. So my son's CVI was missed until he was 5.5. And so if you're listening to this and realizing, how come this has never been put on my radar? It's because the medical community still has a long way to go. But we've made some improvements. The National Institutes for Health just had a big CVI workshop. So now it's a priority. They're creating a CVI registry, encouraging research. So long-winded answer.
No. So many things, but I want to digest it kind of like in three separate parts.
Beautiful.
One thing that stands out to me, and even if I listen to it like again and again, it's just like every single time I process it a little bit different, is, vision is so many things. Like you mentioned, the clutter, that happens if there's too many things going on, coordination, whether it's hand-eye coordination or walking, movement coordination. And then depth, colors, and recognition of faces. And it's just like, at least to me, I didn't realize how much processing or hardware there was behind recognizing so many things that comes to visualization until actually until I met you, because it was from my personal experience very hard to advocate. Okay, now I have the diagnosis, my son has CVI, but where do I start? How do I know how to help him? He is only 2 years old. So he's not going to tell me things. And I'm even curious if older kids can explain things. You mentioned, not everyone gets the CVI diagnosis immediately, that there needs to be some medical improvements on that. And I guess that's to reduce how long they go without it. Because we hear, I think, often in our community, parents say we may have a visual impairment, but we don't know. So what are the maybe most common misconceptions about CVI, and how do kids get diagnosed, as much as you can share?
Yeah, no, great. All great questions. So currently, an eye doctor, so an ophthalmologist or a neuro-ophthalmologist or an optometrist are the medical professional who can diagnose CVI. There are many who know about CVI and have knowledge about CVI and are able to diagnose. So we have a medical directory on CVI now. Not every state is there yet, but we're hoping to grow it, but it's a place to start. And so they'll often really ask you how your child is operating in their everyday. We have the few CVI screeners that have been really popular. The Teach CVI screener, for example, that parents can fill out that help provide data and history taking for the medical professional. And they'll also make sure that the eye conditions, if your child has any other eye conditions, like my son Henry has other ocular or eye conditions in addition to CVI, but what I've noticed in his everyday is more attributed to his brain-based visual impairment versus, for example, his nystagmus or his optic nerve issues. So that's something you have to tease out with your medical provider. But some of them might have them do different tasks in the clinical session, like try to put a puzzle piece in. It's really hard to those visual motor skills. Maybe try to find something in clutter. They'll do the normal examination, but if they're realizing it's hard for them to visually attend something, they'll try to turn out the lights and put some task lighting, like a flashlight on it. And if that helps visual attention, that's going to maybe alert the medical professor that something's going on in the brain that, is impacting visual attention. But at home, it's for a whole host of reasons. Vision is not on our radar as new parents at all. Like, Henry's my first kid, and I had no idea, his vision wasn't where it was supposed to be. We have hearing screenings at newborn, but we don't have vision screenings. So it's just not in general, and every single new parent, it's not even on our radar, and it should be. And so some things to think about is, like, are they missing common visual milestones, right? Are they not interested in pictures or objects? Are they not being able to kind of look between items? or name colors, or do they not blink at a bright light? A lot of kids with CVI, they're actually overly attentive to bright lights, and so they might be staring at them when things are just kind of too overwhelming. They might look at things differently. So are they bringing something close to their eyes to look? Are they tilting their head in a certain way when they're viewing something like at an iPad or something? Maybe just tilt this way. Or Henry would always just like lie his head on the table while he played with a toy. Are they only noticing things that light up? Are they not able to find things or notice things at a distance that you point out? When you say like, oh, look at the bird up there in the tree, do they not really look up because they've just never been understand,
what trees?
Up? Yeah, what are trees? Or they might not even recognize that up there. So do they have trouble with new things, or they're just not interested in new toys, right? Think about those holidays or birthdays. Are they just like overwhelmed with something new? Do they lose things when they drop them on the ground? Like to this day, Henry will drop something and just freak out because it just goes, he just can't find anything, trying to think, they have trouble finding things on like a cluttered table or a countertop, do they dump out their toys in the toy box to be able to find one thing because they can't see something in a cluttered presentation of toys? Do they have trouble making eye contact? Do they smile back when you smile at them? Do they look like they look
many things
through you or past you? Do they get really tired really easily? Like at the end of the day, are they just wiped? Like dinner's really hard. If they're using their vision, do they start rubbing their eyes and put their head down? Do they get really upset in really busy, cluttered, new environments? Like when you take them to the grocery store or the mall?
I didn't think about it like that, but I mean, them, I guess it would be like reading fine print all day for hours and hours and forcing them to like not get lost between sentences. And that's why it could also be, I guess, this maybe it's a misconception, like they could get so tired, like, oh, they're just physically tired from therapy, where they could be also tired visually. Is that kind of like a misconception potentially?
Yep. Yeah. Yeah, exactly. That's a great analogy. It's like if you were using your vision at your max every day, like if you were doing your taxes in the middle of Grand Central Station, right? You would never choose to do that because it's hard, but that's kind of what it's like, You're always at your max. And I think other misconceptions is that, we don't understand that vision is built in the brain. And I think if there's anything that's going on in the brain, you have to consider CVI. You have to consider that's impacting the visual system in some way. And it manifests differently from kid to kid. So it's just important to, your kid. And if you just realize they're just not, their vision isn't quite right, trust your gut and start asking about it.
Yes. And it's so hard, especially in the rare disease world, because you have so many things that come with it. And it's rare that it's like, how do you advocate for it? And especially if you're like a first-time parent, and even as a second-time parent, like it just felt like I was getting a whole new different experience for the first time. And so let's talk a little bit from what you know about CVI and rare diseases, because I think there's been some research done, and I would love for you to give us some insights on that.
Yeah. No, CVI cross-sects a lot of rare disease. We've been talking a lot with the rare disease communities. My son, he has extremely rare genetic variant of the ASTN1 gene. I'm just putting that out there just to see if anybody's out there with that variant, because he's the only one I know and the only one of few. But a lot of rare diseases, CVI shows up, and there's been research around genetic variants and conditions with CVI, CDKL5, for example. There's so many. I could list them all. I don't have them in front of me. But there's been a lot of research on different genetic conditions and rare diseases, including your rare disease as well. And I think we're going to continue to see a lot more. Genetic causes, metabolic causes, other neurological conditions are common causes of CVI as well. And I know there's people with rare diseases who have other causes of CVI, for example, hydrocephalus or pediatric stroke, so anything, again, that impacts the brain, the CVI just needs to be on the radar. Am I answering your question?
Yes, you did. Yes, you did. And
Yeah,
you said something very important because, and I say this because a lot of the parents with Aicardi Goutieres syndrome are listening to this. Noah had 2 global strokes. So we don't know necessarily if the cause was from the stroke or the condition, because we also know at least a handful of parents who did not have strokes with the condition that had CVI. So it's like, we don't know, but at the end of the day, at least for me, I'm at a point that, okay, I received the diagnosis, but what do I do next? How do I approach it? And, how can I help my son? And so that's, I guess, a perfectly next question is, once someone receives the diagnosis of CVI, what should they do next? What are the next steps?
Yeah. Take some time to process. Henry's the first person I'm very close to that has a form of blindness, low vision. And so it takes a while to orient to what that means. And then, of course, I'm going to say go to CVI Now, but there's, CVInow.org has a lot about CVI. CVI Scotland has a lot about CVI as well, just to start processing information, find community. There's several Facebook groups. CVI Now has a parent Facebook group as well. Because parents, as you know, the parents ahead of me figured out so much and gave me so much guidance. And so I think, we're all in a space right now to do that. So really lean into our community. But then also, if you suspect it, even while you're waiting for a diagnosis, you are still allowed to go to the early intervention team or the school team saying you suspect this. Please give my child a functional vision assessment. There are several types of CVI assessments that are given specifically to understand, how CVI manifests. If your child's school age, in addition to that, you're going to want to ask them to do a learning media assessment, which helps them understand what types of learning media are most accessible, right? Is it visual, but then what are the visual adaptations? Are they tactile learners, right? So maybe Braille needs to be considered. You always using real objects during learning. Are they strong auditory learners? So they need to, use audiobooks, and just what are the different sensory channels that need to be incorporated into your child's learning? And for most kids with CVI, a multisensory approach is absolutely essential because vision is not reliable 24/7. Even if they can use vision for certain tasks, it's going to be tiring, and you need to be able to learn concepts in multiple ways using multiple senses. And so what are some of those adaptations look like? These are things that you can even try at home, but reduce the clutter. If you have just a plain wall in your room, in your home, and a place for your child to sit there or play there, you can put like a plain colored sheet over a patterned rug, or a black tablecloth over a patterned rug, or over a busy bookshelf, and just kind of have that be the play area. Just kind of make a simple corner and see what happens and how your child responds. If you have a young kid, looking at toys that are simple, cause and effect, that light up, and see how they respond to that. Light can be a really nice support for visual attention, but light can also be distracting. So kind of undersee where, if there's like strong sun coming in from the window, that might be too distracting. So just kind of play around with the lighting of the environment. Movement can also be a helpful support if you kind of shake things and see if they can look towards them. But it also movement is also very hard to process. So you're going to notice maybe your kid is at the playground, they're going to walk right in front of a moving swing because they don't see fast movement. So safety is a really big issue. But then also try things. Color is such a relative strength for kids with CVI. They really rely on color for visual attention and recognition. So really thinking at high contrast. So a nice dark background with a bright, bold color, like a blue or a green or a red or a yellow, and see how they respond to that. Thinking about your mealtime, I use this nice black silicone mat for Henry, and he has a bright yellow, like partition plate still when he's 11 years old. He loves it. And we make sure it's quiet when he eats. We notice that if there's a we can't play any music or have any long conversations while he eats just because it's too distracting. Eating is a really hard task for him and many with CVI. So keeping things quiet and simple. And really, if you just think about CVI, reduce clutter, bright and bold, keep it quiet, one sense at a time, and see how things go.
All these are great tips. And I love how you also mentioned, at the beginning, finding your community. And so that's, I think, one of the very first things I did. I started looking for resources so I could see samples and see how parents were managing it. Yeah. And immediately the first thing I noticed through Instagram on CVI now were the black backgrounds.
Yeah.
And I noticed our therapy blanket, I think it was pink, yellow. It was my baby blanket that my mom finally gave me. And it was very meaningful because she didn't share that with me with my first kid. And she decided to get to me for my second kid. Mm-hmm. But I realized, I was like, oh my goodness, this is probably not it. No. So I got a white one, but then we have black backgrounds. I put the toys away a little bit better. I started paying attention to cause and effect toys. And I learned that there's also a CVI specialist, and ours is coming for the first time at the end of the month to get an evaluation. So to become a CVI specialist, is it a additional training, right? And do you need a CVI specialist, or can you just get any visual impairment therapist? Because I'm curious to learn the differences and the benefits, just because I don't want to confuse parents. And I think any therapy is better than no therapy, but I would love your opinion.
Yeah. So to clarify, there's no research behind private sector vision therapy and improving for CVI. When I talk about getting assessments, it needs to be from a teacher of a visually impaired, and they are a service provider in early intervention. They're also a service provider in the public schools, and they are trained to work with students on the blindness spectrum with visual impairments. Some know CVI really well, some don't. This is why we're also big. Perkins trains a lot of teachers in the field, so there's training available. And then there's some TVIs who have taken extra classes about CVI. UMass Boston has a 5-course CVI certificate program. So if they've taken that, then they've had the most current, up-to-date research-based information about CVI and how to do assessment. It's such an evolving field. So if somebody's learned about CVI 5 years ago, they need to go back because there's so many new things. We have so many new assessments. We have so many more comprehensive ways to look at our kids and so much new data. And what else do I want to say? Oh, there's also at the school level and at early intervention, there's somebody called an orientation and mobility specialist. And they are ones who help, first of all, assess if your kid is able to navigate the environment safely. For example, Henry uses a white cane when he goes out and about, and he's fallen less, he's tripped less, he's able to have more confidence when he navigates the environment. So they're the ones who help teach children who are blind or visually impaired to safely get around their environment and learn all about those orientation and mobility skills. So you make sure to have assessment with that provider as well. And then one more, there's also, I don't know in every school district, but it's important to get an assistive technology assessment, because that can really help on a whole spectrum for our kids with visual impairments, kids with complex communication needs, to really make sure the technology, any low tech, high tech, is there in place to remove barriers and access to learning. So that's a long-winded answer, but it's good to know all the specialists that you need to bring on your team to help your kid get access to their learning.
Yes. And this is why it's so important to remind yourself that you're not alone, because there's, like you're mentioning, a lot of information. And that's why I really love CVI now, because I can always refer back to it. And correct me if I'm wrong, there's an Instagram and a Facebook group as well.
Yeah. So we have at CVI Now on our Instagram handle. And then we have a private CVI Now parent group that you can ask to join. And it's over almost 2,300 parents. It's really rich. It's a safe place because you have to ask to be in it. And it's very rich, supportive discussions. So lots of wisdom in there.
And within the Perkins School for the Blind, because y'all are located in Massachusetts, correct?
Yep. Mm-hmm.
It's CVI now, and but y'all provide resources globally for anyone that wants, right? Can you expand a little bit more on, like, I guess, the mission, so that, I want to provide information to the families, because as they're digesting what CVI is and what it entails, I want them to refer back to, like, the notes from today and continue to learn and not be discouraged by all this information.
I know, it's so much. It's a lot. It's like breathing through a fire. It's like breathing fire through a hose, whatever the phrase is. But I've been on a long CVI learning journey myself. And just to know that you're on the journey, to know the why behind what you're seeing with your child, why your child might be struggling or freaking out all the time, it's really empowering in a lot of ways. And just to know that why just means we can better advocate for our kids. And I know it's another learning journey. I have a rare kid as well, and there's always something next. It's just like, it feels like every year there's a new thing we have to figure out. He also has a brain-based hearing issue. And so we have new things with devices. Anyway, sorry, don't mean to go off, but I'm just saying,
okay.
I get it. I get how it's like, it's so hard being a disability parent. It's so hard. And it's so exhausting. So I just wanted to name that. And we have a lot of resources on CVI now, just to name that, just talk about the hard truths of disability parenting, the grief that comes with this, all of that. So we have that on CVI now. But so CVI now is part of a larger initiative at Perkins School for the Blind. First of all, Perkins School for the Blind is the oldest school for the blind in the country. It's always been on the precipice of issues that really impacting our community. For example, back in the 1970s, there was a big rubella outbreak, and it caused many children to have deaf blindness. And Perkins was really ahead of that and really supported that, created a deaf blindness program. And so this is just very characteristic of, when it comes to CVI, Perkins really sees this as a hidden epidemic. It's a growing public health crisis, and we are boldly confronting CVI through education, through innovation, through collaboration, right? So we deeply understand supporting families and empowering families are a huge part of our mission. We also have online education for professionals and families. And we're also creating a new CVI Perkins protocol, which is a new CVI assessment, which is really comprehensive, and it really goes through all the things that a TVI needs to understand about your child to be able to create an accessible IEP and educational programming. And we're also creating interventions and a promising practices library for educators as well, just because we know every educator out there is hungry for knowledge about CVI, because they're realizing more and more that there's kids sitting in their classroom. I mean, one study out of the UK said that 1 in 30 kids have some type of brain-based CVI-related visual difficulty. And so we know that there are kids sitting in classrooms that don't have access to their learning. So,
wow. Well, I didn't know all of this information, and I mean, it makes sense because I'm still so new to it, but I did not know it was one of the oldest institutions, and it makes sense, all the advancements they're making, that y'all are making, because you'll be advocating and helping parents and providing caregivers with resources for such a long time, that you're identifying those gaps and making those bridges. And I'm so thankful. I am so thankful, because it is so organized, in my opinion. And it makes it a little bit easier to digest, because it is, like we were saying, it overwhelming, because there's just so many things. Even I think this is the third time we kind of talk, because the webinar, when it comes to webinar, is one. And every time I continue to hear something new. And it's like y'all are withholding information. It's just, we come up with more questions, and I continue to ask even a second part and a third part to a question. And I'm just like, oh, I did not know that. So it continues to be overwhelming, but it's so CVI now. I cannot recommend it enough. It's so organized. And that's why we really wanted to bring you on the podcast, because it's very, very helpful. And my next question is, do you see, what kind of medical advancements do you see for the CVI community in the maybe like next couple of years?
Well, I hope we get more doctors who are able to diagnose CVI. I mean, I think right now we need an agreed upon diagnostic criteria because you can't see it, right? Some MRIs show damage to the visual system, but many don't. You can't rely on specifically an MRI to show that because we know that MRIs miss a lot of things. And so, getting agreed upon diagnostic criteria, effective screening tools for our heterogeneous population. I mean, CVI affects so many different profiles of kids. There are kids who are on grade level, with their peers where CVI is really the only big impact. There are others like my son who has medical complexities, who has, brain-based hearing, CVI, other issues as well. So it's understanding how we can make sure that no kid is missed or falls through the cracks when it comes to diagnosis, and that we can use diagnostic criteria for any profile of patient. And then from there, we also need a very specific diagnostic code. There are some codes that different medical professionals use, but you got to follow the bottom line of these insurance and medical claim codes to really get the advancements we need. And to get more doctors who want to learn about CVI and to diagnose it. So that's kind of where we are. But there's a lot of research happening right now, a lot of research around visual perception, using advancements in virtual reality and eye tracking tools to understand, how people with CVI are and are not using their vision. We're looking at CVI. There's researchers who are looking at CVI and autism and CVI and its impact on reading. So we're so lucky to have more and more researchers in our community really trying to help us figure out CVI. And we're really lucky that we have more and more adults sharing their experiences. This is how I keep learning too. We keep hearing about what CVI is like, and it's just so encompassing, and it just affects the whole being. And I'm just so grateful to learn from adults with CVI because they're really my true north in making sure that we really center autonomy and choice, that we take our child's lead. Some kids like to use their vision a lot. Some don't. Henry doesn't, So I'm going to take his lead, and he's going to learn all the blindness skills he needs to because it's about his joy and it's about what he wants to do. It's not, I can't measure my worth as a parent to whether or not he uses his vision, right? And, we're on this journey of, as disability parents, the expectations are out the door in terms of what it means to be a good parent with our kids. It's, we just got to love them. We got to love them as they are. It's really hard. And I know that Henry's a gift to the world and your son's a gift. So I'm going off topic, but it's just.
No, Rachel, really I'm continuously learning so much. And I was like, I did not know that there was no code for CVI.
Yeah. No.
Until you said it right now. And I just pictured my son's diagnosis, the whole list, and there's a code next to it on his chart.
Mm-hmm.
And I literally, while you were saying that, I went down the list in my head, and I was like, that's right. There's no CVI code. And
there's an old one like
on the provider, I bring it up, but it should be, why shouldn't it be up there? Visualization, eyesight, we use it every day. It should be up there on top of the list. And I'm just, it makes me a little bit mad too.
Yeah, be mad. Oh, I was very angry when CVI was finally on our radar when he was 5. About 5 years being his parent, not realizing how much he was on the blindness spectrum. I don't know if I'll ever forgive myself. I need to. Yeah. And there were ophthalmologists that were like, his vision's okay. It's just he has serious behavioral problems. Why did I believe her? I'll never forgive myself for that. Because she wasn't curious. He was worthy of her curiosity.
Yes.
So there's so much to be angry about, but at the same time, I don't know. I kind of choose love as much as I can.
Yes. And you keep mentioning, and I love it. So I want you to share advice, words of wisdom, because you already mentioned tidbits here and there for parents who just received this diagnosis, or all of a sudden they're listening to this podcast, and I'm like, okay, now I'm wondering, could A plus B potentially equal CVI? And it could not, right? We don't want to alarm anyone, but the more we know, the more we can advocate and maybe bring it up to appointments and it's better to be ruled out than, I guess, not brought up. And it kind of sucks that it has to fall back on us advocating. Like we should not have to do like bring up diagnosis after diagnosis for doctors to like entertain the idea. And you mentioned that. So if you could provide words of wisdom, words of kindness to parents who just received the diagnosis, and even better, perhaps even think about Rachel, 5 years ago when she just, or whenever the timeline was that, your son received the diagnosis, what would you tell her now?
Oh, Lordy. Oh, what will I tell her? Look how you turned your anger into fuel to make sure that no other parent. Well, that's my why. I remember the moment where I got on the CVI learning journey and I started knowing enough to finally understand my son and to finally figure out how to be his advocate. And I'll never forget that moment. And I want every single CVI family to have that moment too. And I want it to happen earlier than us. So that's my big why. And, we all kind of make meaning out of these experiences we have with our kids. And I would tell her I'm proud of her for making this meaningful in a lot of ways. But what really resonates for what you said, and then I'll get to some advice, is like, why do we always have to be the one to bring this up? Why do we always have to be the one to ask these questions? It's like, once I realized that you can't rely on the medical system to help you understand where to go next, right? To help you deeply understand your kid. And I know everybody's human, it's fine, but it's not fine. But at the same time, it's just, this is why it's so hard. And once you realize that, it's like, okay, it's the system not set up for our kids with complex needs, with disabilities. It's not me. Once you can kind of extract, how hard it is, that it's the system and it's not you always not being enough or you always doing things wrong. I think it helps on our healing journey, as parents, to be able to make this sustainable and to be on this marathon. But I'm so glad you brought it up. And still to this day, it's like, here I am emailing this doctor, like, I think we should consider. I heard. Anyway, so what was your question? Advice?
Yes. So for the parents that are listening to this, I mean, you're doing a fabulous job, Rachel. I am so glad we continuously get to know each other better, and that others are getting to know you, because you have a strong why, and you're not only helping people in your area, but you're helping people like myself in Texas. So the question was, if you could give advice or words of wisdom to the parents or caregivers who just received the diagnosis that their loved one has CVI, what would you tell them?
So if you suspect it or you finally are able to get a diagnosis, I think continue to take your kid's lead and take the time that you need. It's really, for me, I felt like I was just going with this massive sense of urgency because it was later, right, for Henry. But at the same time, that means I was burning the candle on both ends, and I wasn't taking care of myself as I was diving into learning and trying all the things and just going to all the nightly webinars and everything. And it wasn't good for me or wasn't good for my family. So pace yourself. Like you said, the information's here on CVI now. There'll be a lot of recordings. Take your time and just really get to know your kid in this new light. Take videos, to see how they're navigating the stairs, or like take a video of when they're eating. And, those videos are really helpful in getting a diagnosis. For some families, they're also really helpful when you go to show like, hey, just learn. I think my kid has CVI. This is what I'm noticing at mealtime or when they're playing, because I think we have the most observational data of our kids. And so being able to capture that and show it to the providers that are working with our kids, it just for them, seeing is believing. So helping them understand it's there, it's a big impact, and just like try one thing at a time, maybe just, try a black mat during eating, or maybe just, I went to Staples and got those big black trifles and I put it in front of him during, is that what you did too? And he finally ate for more than 10 seconds, and it's just just try one thing at a time. We have some at-home strategies coming out on CVI now. Parents are really resourceful, but keep a pace to make sure that you stay healthy and you stay okay. And just, I don't want to say enjoy getting your kid. Videos. I'm petering out here. But also make sure, I think the critical thing is that you bring this to your team and say, my kid needs these assessments, because the more you can get the team to understand how they need to adapt materials and how they need to adapt the environment for access to learning, the better your kid is going to have a more accessible time with EI or an accessible school day, and hopefully the more ease and joy that they can have in their lives.
Rachel, I am so thankful that you made time to speak to me and to make time for our Aicardi Goutieres syndrome community, and to any rare disease advocate parent, and to anybody listening to this podcast. I think they can agree with me that this was beyond helpful, and I cannot thank you enough for coming on. And I'm like, do we need a part 2? Because
I'm here. I love talking.
Do we just need another reason to hang out?
Can I ask you a question?
Yes.
What were some of the things that you, flip that question on you, when you learned about CVI? What are some things that you did right away or that you tried that were helpful?
Yes. So I first found out about CVI probably almost a year after my son received his genetic diagnosis. So I think it was a little bit, he should have been evaluated sooner, for sure. And what I saw another baby with leukodystrophy on social media. Mm-hmm. And the first thing that stood out is that she had a black board, so that she could get seated, propped up, and then she would have that contrast going on. And so that sparked my curiosity. So I took a screenshot and searched it, and that's how CVI came up. And so I think even before I read further information, I immediately went online and asked, I think it was Shipt or something, to bring me a blackboard from Michael's, a black trifold. And then I immediately started trying to get an appointment with an ophthalmologist. And I think I received the diagnosis in June, and then until the next year of February, someone said, yes, we do suspect CVI. And I was just I had to go out of state to get an ophthalmologist to agree with me out of state. So I'm in Texas, and a lot of families know that when we travel to Philadelphia, where they have a leukodystrophy center of excellence, and we just kind of tackle everyone, and we just see everyone. And so, so that was the first thing I did. And then I started searching through social media, because that's kind of when I take my breaks. And I was still in that phase of kind of with when a deer sees headlights coming at them, I just didn't know where to move. I was still digesting everything that was going on in our family. And I can only digest bits and pieces. And the best way that I could do it was through seeing if any other families were going through similar situations, and if I could just see one post at a time, because it's still very scary, but I feel I can hang on to the seat now because I have a seatbelt on or something. But yeah, so that was the first thing. And then it all made sense why Noah was so attracted to lights. And all of a sudden it made sense, or why sometimes he wouldn't, and also went through a grieving process, because we never saw that milestone of him tracking our faces.
Right.
And that raised flags at the beginning. And that's when we started telling our pediatrician, it's hey, he's not tracking our faces. And they're like, are you sure? I'm like,
good for you.
Yes, I can tell that.
Yeah.
So, there were so many little signs, but at the time, our provider was just kind of I get it, kind of thinking best case scenarios. Every kid learns at a different pace. It's going to be okay. But I was already thinking there's something fishy going on, some worst case scenario. And so, Yeah, so that was a little bit of our experiences. But once we got the diagnosis, everything started piecing together and everything made sense. And then we found a neuro-ophthalmologist and they confirmed it. Like I just wanted to be sure about everything. And then that's when, after I got the second confirmation, when I found out about CVI now and started like advocating to see if I could get some evaluation done at home. And it's been a process. And I'm still just at the tip of the iceberg, but at least I'm on the right iceberg.
There you go. You're on the iceberg with us. Welcome.
Thank you. It's one of those things that I tell everyone is like, I am so sorry we're meeting this way, but I'm thankful that you you found your why and you're like, you know what? Like I don't know about so much about your journey, and maybe this can be a different occasion, but did you start working for Perkins School for the Blind after your son got the diagnosis?
Yeah, a little while. So I'm a former special educator, middle school. So, come from the education field. And then I moved into curriculum development. We were living down in Maryland. And so I've been working at Perkins for about 3.5 years now. So it's still some time after the diagnosis, but I got connected to the parent community and to Perkins and went to their conferences. So
it unfortunately all fell together. Fortunately and unfortunately.
I feel so lucky. Yeah. Yes. Nailed it. Exactly. But I feel so lucky that I have a job where I can marry a personal passion with my skill set. But it's still hard sometimes, right? It's very close to do something that's very close to the heart. I have to take care of myself extra more.
Yes, I completely understand. All these interviews are my why, because I do them for my son and I do it for other families. But then also, like, my audience may notice it or may not notice it, but I get scared when I listen to some of these things and I get a little bit sad because it either brings back past trauma or all of a sudden, like, I'm like, oh, I have a million things to do after this now because I just learned so much more. But luckily, I don't feel like that today because I've been working on this for a while and I feel like we're on the right track. But I want to go ahead and thank you for your time, Rachel. I am so happy we met, and I'm so happy you came on the podcast.
Oh, it's such an honor to be here. Thank you for sharing this space with me to connect with you. It's just so wonderful. You're a gift. I appreciate it so much.
No, I cannot say thank you enough. But what I will do for our audience is I will go ahead and write down all their social media handles, the website, the Facebook down in the description box. And if you're just listening to this, in the video version, we'll also have any deck slides that Rachel can provide us so that you guys can also follow along for examples. We'll add that. And Rachel, thank you so much. We'll be in touch. And I'm so happy you listened to the Rare Advocates.
Thank you all. Take care of yourselves.